is Amaya Williams, and today will be presenting my presentation titled "One Choice Saves Lives." This presentation is about the importance of having abortion access in cases of rape, incest, and health risks. In the United States, abortion is one of the most controversial and sensitive topics. This presentation will focus on the significance of having access to abortion in situations involving rape, incest, and when the mother's health is at risk. In these situations, refusing to get an abortion, not given the option to have an abortion, almost seems unfair and inhumane. Abortion has always been an ongoing debate and discussions about ethics in the law. For years, everyone has always went against the process of having an abortion due to people saying it is a breathing fetus from the time it goes in the belly, from the time it makes it out. But what some people have to realize is that not all babies can be carried out if a mother's health is at risk, and it may be traumatizing for someone to have a baby when they have been raped or they have conceived the baby through incest. So going through this whole process of being forced to give birth should be talked about. It should be looked at a different perspective. In the past, there have been exceptions for rape. There have been exceptions for rape, incest, and health dangers. However, they have recently come under fire. It is more difficult to survivors to get censored in 2024 since so few states have clear legal protections variations made for unequal access to abortion. Here is a scale, basically, by all the allowed abortions. The psychological impact on survivors of rape and incest. As I stated before, many women go through rape, and during it they are conceived and they get pregnant. Most of them are forced to have birth due to not having access to abortions. This causes depression, anxiety, and PTSD within rape and incest survivors. In many situations, denying abortion worsens the psychological pain and trauma, especially for young survivors. So going through rape and then finding out you're pregnant is already trauma. Then being forced to carry out a baby that you did not ask for is even more traumatic, and again should be looked into more. Health risks to the mother's well-being. Sometimes bringing a pregnancy to term puts the mother's life or health in jeopardy. I don't know if you've heard, but in some cases, it has been a situation during birth where it's either the mother's life or the baby's life. The mother's life may be in danger if critical care is delayed due to legal ambiguity around abortion regulations, legal confusion, and medical emergencies. Healthcare professionals become confused when abortion laws are unclear. Doctors frequently question whether they are legally permitted to perform an abortion in medical emergency, endangering the patient's health. Health risks are increased as a result of this uncertainty, which delays care. Abortion access is a human rights concern. Having access to abortion, it is more solely looked at as a human right. In situations where someone has been raped or, as stated again, the mother's health is at risk. So allowing an abortion to be an outlet is a basic human right. And basic human rights are violated when abortion is prohibited in cases of rape, incest, or health hazards. For people in these situations to be treated with equality, fairness, and dignity, access to abortion is essential. Restricting access to abortion increases healthcare inequalities, especially for marginalized and low-income communities. You never know if these people are able to afford to take care of a baby. So, unequal access to abortion services is severely limited for residents of states with strict abortion legislation. So basically, access to care is very limited to states that have very strict Abortion laws. Many people lack the funds to go for an abortion, especially those who live in the rural or low-income areas. The consequences of denying abortion. Abortion denial results in long-term financial, emotional, and bodily trauma. In these extreme situations, excuse me, those who are refused abortion may have ongoing psychological trauma, medical issues, and financial hardship. Like I spoke on before, forcing someone to have a baby through rape, incest, or health risk is very inhumane. You never know what anyone is going through, and how the baby was conceived. It's very traumatic, and being forced to have the baby while going through that traumatic experience is even more traumatic. You never know if someone is ready for the financial responsibilities of a baby. So looking into a family's income or any little thing like that should be looked at before just forcing someone to have a baby. Abortion opponents, religious and ethical concerns. The opponents of abortion contend that abortion is wrong since life begins at conception. Like I spoke on earlier, people believe that the fetus is very full the moment it is conceived. Although these opinions are legitimate on an individual basis, public health policy shouldn't be based on them. Here is a video that takes a deeper dive into abortion being legal. Decisions about healthcare should be made based on patient welfare and scientific data, not on your personal beliefs. The topic around abortion is very biased. It is very based on personal beliefs instead of taking a deeper dive into the statistics of financial needs and your mental health. Experts in medicine and ethics argue that laws should be put into people's health and safety ahead of irrational moral or religious convictions. In conclusion, for the sake of human dignity and safety, abortion must continue to be legally available in situations including rape, incest, and major health hazards. Access to abortion is dire, which worsens inequality, health risk, and trauma. Human rights and evidence-based healthcare should serve as the foundation for legislation, guaranteeing that everyone has access to necessary medical treatment.